for the light. Okay, there you go.
Good morning. Today I have a really unique topic. I just have one question for you guys. Have you ever heard of MS? Have you ever heard
Microsoft.
of No, MS, or as you can see, it's called multiple sclerosis. Have you ever heard of this disease? Actually, it's a disease, and to make you understand more the meaning, multiple means many, right? Many things, and sclerosis means hardening. So when something is hard, they call it sclerosis. It's a condition when something is hard. And where do you think actually this disease will be located?
The nervous system.
In the brain.
Right. What do you think? What other things you can see? What do you think?
In the cells.
So actually, the cells are included in all of our body. So basically, all of our bodies are involved in this condition. So to start with, I have this. I will tell you the definition of multiple sclerosis. It's an autoimmune disease. It insults the covers of the nerve cell in the brain and spinal cord, so they are really damaged. So you can see this is the nerve cell. These covers, because of it's an autoimmune system, so this is the target. Those cells, and as you can see, it's an illustration that is a normal nerve cell, but this is a damaged one. You can see the myelin of the nerves is damaged because of this disease. So the mechanism of how MS works, it's a genetic or environmental factors such as an infection. It makes a distraction by the body immune system. So those factors, whether if it's genetic or environmental, they cause the body immune system to attack these myelin cells, or even make it fail to produce these myelin cells, and which will cause that damage in the myelin cells. And you can see it will start appear with some signs and symptoms in form of attack. So it will not just directly come to you and you will have these signs or symptoms. They will attack you suddenly. Suddenly these nerves are attacked by the immune system, and the signs and symptoms might appear later. You can see the form of MS. We have two forms of MS. One is relapsing form, or isolated one, which it will come to you for directly. You will suddenly go down, or it will be building up by the time, which is a progressive one. So once, for example, if MS attacks my nerve in the vision part, if it was isolated, suddenly I will have some vision problems. But if it's building up by the time, I will lose, for example, vision. Later, it will I have another attack. It will cause also a vision and a tasting problems. You can see it's building up. This is an MRI image. You can see here it's in this patient's MRI. It's isolated. So first it comes here. You can see it's here where the attack happens, and that is in August. Later it disappears and it comes back normally. October also. And then in November it will have an attack in this part. So as you can see, this one is an isolated form. It comes in isolated form. Signs and symptoms. There are a wide range of signs and symptoms may occur, including physical and mental symptoms. So I have a question for you all. What do you think are the signs and symptoms that may occur in MS patients? What do you think, Fadwa? If it's connected with your brain.
Maybe some pains inside of the head.
Mental and physical.
focus.
Right.
You feel dizzy.
Right. Any other?
Faint.
Faint. Nothing?
You lose
No.
the
If it's connected to your cells, what does it mean? Your nerves.
Disability of smell or taste.
Right.
Or
It's connected to all of your body. It's a list. This is a list of common signs and symptoms. Like for example, weakness. Suddenly you might. This are the beginning. You feel weakness, balance problems, and dizziness. You can have cognitive problems. For example, like the memory. You start lose your memory in a really young age. Depression. If something has happened to your brain, actually, everybody can have a depression because it's really connected to your brain and your spinal cord, and everything is connected to your body. So basically, you can have a depression because of that. As I said, vision problems. It depends on where the attacks happen in the brain. Numbness and tingleness. You can feel that for example, when you walk a lot, or when you are sitting in your seats a lot, you can feel numbness. Your muscles are numbed. You can feel or tingle like puncture or something like that. You can feel it in your muscles. Muscles pain and stiffness. Sometimes MS patients they cannot move suddenly because of their muscles are stiff and they have pain in there. And about the diagnosis, since these signs and symptoms are really common, for example, if I were having a virus, I can feel dizzy, or I can feel for example, I can have a high temperature, also
Headache.
a headache. These symptoms and signs are really common, as you can see. For example, you can feel pain in your muscles. It's really okay when you are sick, right? But for this kind of sophisticated disease, it's so how can I say this? It's so
intensive.
hard to understand that you are having this
Hard to figure out.
yeah.
How to diagnose?
Yeah.
Hard to diagnose.
And you cannot diagnose it only, for example, with laboratory tests. You have to do a laboratory test, and you have to do a radiological imaging, like MRI, because MRI tell you exactly if you are having it or not. Or you can have a lumbar puncture. You know a lumbar puncture? Lumbar puncture is when they take a biopsy from the fluid in your spinal cord, from the lower back. And from this biopsy, they can figure out if you are having this kind of disease or not. So basically, it's really, because the same disease is sophisticated, the diagnosis is also sophisticated and hard to get. About the treatments, actually there is no treatments for MS. Currently there are no, to cure it completely. There is no treatment, but there are treatments that can improve the function of your body after an attack happens, and also it will help you it will help to prevent attacks in the future. It might help only, not just to cure it, 100% cure it. So why I chose MS as a topic for my presentation? First, that my sister was diagnosed with MS in 2009. It was really shocking for her and for us, especially that she was here in the United States alone. She had nobody with her. She suffered, actually. She suffered a lot. And actually, my dream is to figure out something to cure it. Later on, I'm applying to maybe have to be a doctor, but I will be a researcher, inshallah. People have to know more about it, because as you can see, the signs and symptoms, because they are really common. Not everybody understands this disease, and because it's not appearing a lot, people, they don't pay attention to themselves when they are having these kind of signs and symptoms, and that's why they do not figure it out until it's too late. And it's a serious problem with common signs as well. For a discussion, everyone